Hello and welcome. Let's talk about something that seems super straightforward, but as you're about to see, is actually pretty fascinating. We're going to talk about how a ventilator really delivers a breath. We all think we know about tidal volume, but today we're peeling back the layers on this very basic function.
Okay, so before we even get to the nuts and bolts of the machine, we have to talk about something a little unexpected: language. Because in a high-stakes world like medicine, getting the words right isn't just a nice to have, it's everything. It can literally be the difference between clarity and critical, dangerous confusion.
Think about a phrase we all use, right? It's not rocket science. We hear it all the time. But what do we actually mean when we say that? Usually, it's just a shorthand for saying something isn't very hard. But here's the catch. To a physicist, that exact same phrase could mean the complete opposite. That something is chaotic, that it's not predictable at all. So you have the same words, but two totally different meanings, and it all just depends on who you're talking to. And that kind of mix-up is exactly what we have to avoid in healthcare. When it comes to something like mechanical ventilation, making sure we all have crystal clear, agreed-upon terms is absolutely critical for patient safety. And that brings us right to the heart of our topic. So, with that in mind, let's dive in and really nail down our first key concept here: tidal volume. Let's start from square one. What exactly is tidal volume? Well, if you crack open any textbook, the definition is pretty simple. Tidal volume is just the volume of air that gets inhaled in one single breath. That's it. That's the baseline we all learn.
And this seems to play out in practice, too. I mean, if you're in a common mode like volume control, you set the tidal volume, and the assumption is that the ventilator delivers that exact same amount of air with every single breath. Seems simple enough, right? Well, this is where things start to get a little more interesting.
See, it's not just a one-way street. It's not only about the air going in, it's also about what comes back out. Let's take a look at the really critical relationship between inhaled and exhaled volume. In a perfect scenario, what goes in must come out. The amount of air that a patient inhales should be pretty much exactly the same as the amount they exhale. You want a nice, balanced closed loop. But of course, things aren't always perfect. So what happens when it's not balanced? What can we figure out when those two numbers, the volume that went in and the volume that came out, don't quite line up? Turns out that mismatch becomes an incredibly powerful clue. It's like being a detective. If the inhaled volume is bigger than the exhaled, you could be looking at a leak somewhere, or maybe even air trapping, where air is getting stuck inside the lungs. But if you flip it, and the exhaled volume is bigger, well, that might point you towards something else entirely, like a nebulizer adding extra gas to the circuit, or maybe just a sensor that's on the fritz. It's a tiny difference in numbers, but with huge clinical implications. Okay, so we're starting to see some of the nuance here, but now we're going to get to the real heart of the matter. A pretty common misunderstanding about how these incredible machines actually do their job. So here's the assumption many of us make. You set a tidal volume on the screen, let's say 500 milliliters, and you think the ventilator is sort of like a big syringe, just directly pushing exactly 500 milliliters of air into the patient. I mean, it makes sense, but it's not actually what's happening under the hood. So, if the machine isn't just pushing a set block of volume, then how on earth does it manage to deliver such a precise amount, breath after breath after breath? And here it is. This is the real magic. Ventilators are absolute masters of one thing, and that's controlling flow. They control the speed at which air is moving, and they do it for a very, very precise amount of time. It's the combination of that exact flow rate held for that exact duration that ultimately results in the delivery of a target volume. The source material we're looking at really nails it with this quote. In the true sense, flow is controlled by the ventilator. That's the one thing the machine is grabbing onto and directly manipulating. So if you're going to take just one thing away from our chat today, let it be this. Volume is the result. Flow is the action. Ventilators don't really push a volume. They manage a flow rate over a set period of time to achieve a target volume. It's a subtle distinction, but it's a really fundamental one. So I'll leave you with this final thought to chew on. Now that you know that a mechanical breath isn't just a simple push of air, but this incredibly calculated dance between flow and time, how does it change your perspective on what a breath from machine really is?